finally, we'll welcome Cris Harrelson of the Brunswick County Health Department. Welcome to the show today, Cris.
Thank you for having me, June.
It's a pleasure to have you here, and I know that you're going to share some really good information with us. So let's start by you telling me about yourself and your role with the health department.
Okay. Well, I am a Bladen County native,
Really?
But have long-time ties to Brunswick County. I've been coming to Brunswick County beaches, our family's own property here, since I was about 10 or 12 years old. So it's been like a second home to me.
Great.
I've worked the last 22 years in public health, the latest being as Health and Human Services Director in Bladen County, but then assumed the Director of Health Services duties in October of 2015 here in Brunswick. One of my better decisions in life. Glad to be here.
That's what I always say. We moved here quite a few years ago, and I just wish I'd done it when I was like 12 instead of, you know, it's just so nice here. We absolutely
great
love
people
it.
here.
Yeah. Well, today I want to focus on the community health needs assessment, which we at the hospital have been very involved in, and it was recently conducted in Brunswick County. So again, we were really proud to partner with the health department on this initiative. So let's start at the beginning. Tell us what the needs assessment is and how that is conducted.
The community health assessment is a collection and analysis of the data concerning the health of the county. And we collect that data in two primary ways. The first way is through a survey that we send out to the community, all the municipalities, all the communities within Brunswick County. And we ask them specific questions about their health, their demographics, and what their concerns are about the state of the health in Brunswick. After we get the data back, we examine it, and if it appears that there's one area of the county that may not be represented properly, we'll go out to those areas and do town halls or little community forum meetings to make sure that they do have a voice in the community survey. The second method that we use is actually looking at statistical data that we pull from local, state, and federal resources, such as the CDC, the National Institutes of Health, some of our own local data here, and U.S. Census Bureau could be one. So once we get all this data in, we gather a team of community partners, and Avant was part of that, and we appreciate your help and your input on that. But that team is called the Community Health Assessment Advisory Team. And that team sits down and they look at the data and they compare the data to the state of North Carolina, to 3 peer counties to Brunswick County, and then also to ourselves, what the last community health assessment showed us about Brunswick County. And then after they compare the data, we'll determine the top 3 health priorities within the county, and we'll develop a strategy to address those in the coming years.
Well, how often is the assessment conducted?
Every 4 years, and in the years in between, we release a report on the progress that we're making towards those goals.
Can you share some of the key learnings that, that you have from the assessment?
Right. When looking at the data from the surveys, these are our community residents' our opinions about the state of health.
Yeah, because it is just their opinion, correct?
Yes. They are concerned with drug and alcohol abuse, obesity, and chronic diseases, such as diabetes and hypertension. Interestingly enough, when we ask the question, what do you feel your community needs to be a healthier community, their number one answer at 42% was more jobs.
Really?
More jobs, yes ma'am. Which makes sense when you think about it. Because when a person works, they are improving their socioeconomic status. And there is a tie with socioeconomic status and good health. And if they have income coming in, they're more apt to buy health insurance, or their employers may provide health insurance for them. Either way, they're gaining access to health care.
And would that be one of your goals? I'm interested in the primary goals of the assessment.
Well, after looking at the hard data, the statistical data that
Right.
we got from CDC and other places,
Right.
the team determined that we have 3 priority items that we need to address.
Uh-huh.
Number 1 is accidental death and injury, because
Okay.
Brunswick County has experienced a spike in that.
Uh-huh.
The other is mental health and substance abuse.
That's a big
because,
one.
just like other counties in our region and
Right.
across the United States,
Yes.
we're experiencing an increase in drug and alcohol addiction. And the other is chronic disease management. We've
Mm-hmm.
made some great strides forward with preventing chronic diseases and with managing it, and we don't want to drop the ball on it. We want to continue to move forward.
Well, one last question. Is it possible for the community to access this, the assessment?
Absolutely.
Is it online? or-
It is. It's on our website, which is www.brunswickcountync.gov. They can also come to our office at 25 Courthouse Drive, Bolivia, and we have hard copies.
Well, that's great. That's great, because there's some interesting information in
It
that.
is.
And so,
Well,
yeah, I
Jim,
think it's very worthwhile to go out there and see
it
what it
is.
says.
And I consider myself blessed to be in this position
Right.
where I can work with great community partners, the healthcare leaders within Brunswick County, and we can put resources towards these issues because we all want a healthier community.
We do. And the health department goes above and beyond. I will say that the health department does a fabulous job in Brunswick County.
Thank you so much.
And thank you for being here today. It's been a pleasure to have you,
It
and
has
I
been.
look forward to seeing you again. Let's don't wait 4 years, though.
That's right.
We'll come back and talk about the action plan. How's
Yes,
that?
sounds great.
Great. Well, thanks again for being here.
Thank you.